All right, welcome everybody. This is the Wildly Thriving podcast where we cut through the noise of conventional medicine and bring you real conversations with coaches who have healed chronic illness naturally. These are practitioners who've walked the path, found the root causes, and now help others thrive beyond their diagnosis. Today, we're on the show chatting with Dr. Lena and Collin. They are practitioners, holistic health practitioners, and chiropractors and co-owners of the Wellness Way out of Wesley Chapel in Florida. Together, they help patients uncover the root causes of chronic illness through a personalized whole body approach. Dr. Lena focuses on fertility, hormone balance, and supporting children with skin, gut, and autoimmune challenges, while Dr. Collin's own struggle with Crohn's disease fuels his passion for walking alongside patients with digestive issues, mold toxicity, and metabolic health concerns. And he's a proud advocate for the MAHA movement. As partners in both life and business and parents to their son Vincent, they are dedicated to rewriting the healthcare narrative and empowering families to heal naturally. Thank you guys so much for being on.
Thanks for having us.
Yeah, we're excited.
Absolutely. So I was binging your guys' social media a little bit, and I would love to have you guys just share your own personal story first, just to get the listeners to understand where you guys are coming from and why you chose to go down this path of holistic healing.
Yeah, why don't you lead it off?
So we went to chiropractic school, obviously, and in chiropractic school, they teach us a lot about adjusting. And what we were noticing with our patients is that they would come in and get adjusted weekly, but they weren't necessarily getting better, or they had other issues that they would talk with us about that they felt weren't being addressed by their other doctors. And we would think to ourselves, like, how can we help with this? But in school, they're teaching us refer out. And, they get into this referral process. It's a vicious cycle and all that. And then lo and behold, Dr. Collin was unfortunately diagnosed with Crohn's disease when we were going through school. And we went the conventional route. He had multiple gastroenterologists, colonoscopies, was on a ton of different medications, and it wasn't working for him. He almost, you got sicker. Yeah. You got a lot sicker. You got down to 100 pounds, and he's 6 foot, so 100 pounds and being 6 foot, not very cohesive. So, you were super sick, and we were thinking, there's got to be something else. And that's how we found the approach that we now implement with our patients regularly, the Wellness Way approach. We implement the chiropractic philosophy, which involves utilizing things and tools to address traumas, toxins, and thoughts, not just addressing traumas. So all the three of those T's that are in conjunction working together to cause inflammation within our bodies.
Wow. Yeah, that's insane. I definitely want to hear more about your story, Collin, because 100 pounds at 6 foot is actually insane, and I would be shocked to just see what you look like emaciated. So what would you say was the contributing factors to the development of your Crohn's disease situation?
Yeah, well, it's interesting because when you go to your primary care, you go to a gastroenterologist, they're quick to jump to saying, oh, it's genetics. And when I was first told, oh, it's your genes, I'm like, okay, well, I guess that happened overnight. That didn't make any sense to me initially. And on top of that, I did not have one family member with an autoimmune diagnosis. There's cardiovascular risk in my family, but nothing with autoimmune disease, let alone IBD, Crohn's ulcerative colitis. So that was already initially a red flag. And I would say things that drove my autoimmune condition after understanding what drives autoimmunity was a combination of things, but primarily me ignoring my body, ignoring the signs and the symptoms, my body screaming for help, having ulcers as a kid, having a lot of anxiety that wasn't addressed, not properly eating the right foods, right? Being in environments that, whether that's mold or being around a lot of chlorine because I was a swimmer, just being stressed out all the time. It's a combination of things that really drove that autoimmunity. Yeah. And eventually you hit that tipping point, and that's where that diagnosis comes into play.
Yeah, that's huge. And the The thing that we really need to understand is that when we are in a state of constant stress, in your case being anxiety, we are shutting down, signaling to other systems within the body to basically not operate functionally. We're in a sympathetic dominant state. So now the vagus nerve, the vagal tone, is being affected. And where does that run? All the way down to your diaphragm, and it controls the digestive enzyme release. Okay, very important for digestion. So when we're eating all this food in an anxious state, it's building up, fermenting in our gut, causing dysbiosis, damaging the lining in the gut. That's Crohn's disease. It's never genetic. You could be genetically predisposed to something, but it doesn't mean that you're inevitably going to get that disease. You get what I'm saying? It's like
Absolutely.
your environment, your lifestyle choices impact everything. You know, it kind of loads the gun, genetics do, and then how you live your life pulls a trigger. So,
Yeah, we say that all the time.
And that's really what epigenetics comes down to.
Exactly. So my next question is, Dr. Lena, what life experience did you have that sent you down this path? Like, was there something that you battled yourself with your hormones maybe, or maybe just like something that kind of woke you up to, oh, the conventional route really isn't the best route for my health or for my client's health?
Well, I would say, obviously, watching him go through what he went through really pushed me down this rabbit hole. And then that's when I started to recognize, okay, a lot of the stuff that I was experiencing too was not normal. I thought it was normal. Like, I've had painful periods my entire life. I had been on birth control on and off from the time I was 17, and it made me absolutely crazy. I could not go to the grocery store by myself without having a panic attack. And I 100% attribute that to the way my hormones were based off of being on birth control. Because when I stopped taking it, it was like I could see everything so much clearer. I felt better. I wasn't crazy anymore. And you can attest to that, right? But I also had battled a lot with like skin issues. I always say I'm the queen of skin issues. I had eczema. I broke out in hives to literally every product that you could possibly put on your skin. There was one day I woke up, I literally had blotches all over my face. I had welts all over my body. And I was like, what the hell? Where did this come from? Like, I had no idea. And I was constantly on steroids, constantly on antibiotics. Obviously, those don't do well with your hormones. So then I would wreck my period, or I wouldn't get my period because I was a pretty intense athlete. So I would miss my period for probably 6 months out of the year. And I was like, this is not normal. I don't feel right. Nothing felt right. I would gain weight, lose weight, gain weight, lose weight. It was just a vicious, like, unraveling of what was going on with my body. I didn't understand it until I saw him go through something pretty intense. And then I started digging into myself. And I was like, yeah, I need to do something about this, because I want to have kids one day, and having no period, it's like, you're really going to struggle to have children,
Mm-hmm.
So that was a big factor for me.
Absolutely. Let's dig into that a little bit more, because I think women are just told that all of these painful cycles are normal. It's okay to miss your period every once in a while. It's not a big deal. Birth control is totally fine. It's totally healthy, as if it's not completely suppressing and shutting down an element of your endocrine system. It's like so like flabbergasting that doctors are not educated on this. And, we could talk more about this later, but it's 100% intentional, the reason they do that. But I digress. So I wanted to talk a little bit about like the actual symptoms that we get and what they mean. Like, when I'm bleeding super heavy, what does that actually mean about my hormone balance? When it comes brown, what does that mean? What have you seen?
With periods, I've seen anywhere from they're not getting their period to they're having their period for 50 days at a time. And obviously those are two very strong ends of the spectrum, right? So typically what happens if you're having your period and it's really heavy, or you have clotting, or you have those intense PMS symptoms like cramping, breast tenderness, mood swings, typically that is a sign of estrogen dominance. And you can have estrogen dominance, whether that be from having too much estrogen or you have really low progesterone. So in either of those cases, you're going to have estrogenic-like symptoms. And I think it's important to note that we don't have just one estrogen. We actually have 13 different estrogens. They're estrogen metabolites, and most people are not testing for those, so we're not understanding what that metabolism looks like, what your liver health looks like, and on the other end of the spectrum, if you're not getting your period or you have a super light period, like it's like a light pink color, that's typically a sign that progesterone is very, very low, or you're not ovulating appropriately. And that's where it's like a lot of the stress plays a role in that too. But yeah, that's typically what I'll see. And then that light period is typically associated with like polycystic ovarian syndrome. And on the other end, if you're more estrogenic, you're going to end up with more like endometriosis type of symptoms.
Mm-hmm. Yeah, and like you were saying, there's a way that your body is metabolizing your estrogen. It's not just how much you have, how you're actually metabolizing that. Is it going down the 2-OH pathway, the healthy pathway where it recycles, or is it going down the 16-OH pathway where you're building those fibroids? It's got too much tissue growth, okay? That's why I like to run a Dutch complete test to see the insights for my hormone clients. Like right now, I'm working with a girl, she's 22, she got exposed to mold in her workplace for 6 years and has lost her menstrual cycle for 2 years. And I'm trying to constantly remind her, helping her with self-concept work, that like, hey, you have all your, reproductive organs. It's not the end of the world. You don't even want to have kids yet. So like, let's be patient with this process. It takes a little bit of time once you've been shut down for that long. But we just did another Dutch test and her estrogen was like bottomed out. Like she had nothing. So it's like, no wonder you don't have a menstrual cycle, So that's thanks for sharing that. That's important for us to be aware of, and just to remember that, like, hey, as women, we don't have to suffer through these things. We could get a Dutch test, see where our hormones are at, and then we can heal that naturally with just simple lifestyle changes. Like you were sharing, when you had lost your menstrual cycle for 6 months, I was smiling because every time that I would do a bodybuilding show, I would completely lose my cycle almost immediately. And guess what else was happening? Cystic acne, hair was falling out. I felt awful all the time, and it's because, number one, overtraining, undereating, high amounts of stress. Mm-hmm. So we have to understand that the input or the environment that we're in, or the choices that we're making, can impact our hormones greatly. That's actually like the meat and potatoes. That on top of just not getting enough of the building blocks, right? So not getting enough cholesterol in the diet. And that's why, like, I feel like that generation that went on the low-fat diets or the crash dieting have so many, like, hormonal issues, and they look dry. They're kind of, like, going into menopause early. It's because they've lived a life where they, like, had no raw materials in order to even build their hormones. So just keep that in mind, ladies. Like, you do not have to eat a low-fat diet. You should never be under-eating if you want to have healthy hormones and you want to be fertile. Like, just let that be a reminder to you to, you need to live a healthy lifestyle if you want to, feel and look good in your body, okay? So, I would like to ask you guys a question. I know we chatted a little bit beforehand, but what is the most misunderstood thing about healing that you feel like your clients are struggling with, or do you think the world struggles with?
Yeah, I would, and this kind of gets floated around a lot, but it's that health is not linear. I think a lot of people, when they come in, they think that they're just going to start climbing this mountain and that there aren't going to be any roadblocks or hiccups. We're constantly encountering new stressors, right? We switch jobs, we meet new people, we move homes. Like, there's so many different things that can increase or decrease our stress, and as we go through our healing journey, it's not always going to be pleasant, and everyone thinks that it's going to be. That's my takeaway. And you have to prep patients for that. You have to say, okay, look, as we start working on the gut microbiome, as yeast start to die off, things aren't always going to be sunshine and rainbows right away, right? As you're starting to methylate hormones a little bit more, as you start to detox mycotoxins out of our system, it's not always going to be pretty.
I like to use this analogy. It's kind of like you're driving in the rain and all of a sudden you hit a slippery patch and your car goes, wah, 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 and we're trying to like get it back to center. That's kind of how it goes. You know what I mean? Because for so long we've been driving in the rain. And eventually we hit a rough patch. And once we start to like reintroduce these things like, antimicrobials, and we're actually starting to break down the things that are giving us these like horrific symptoms, you might get some Herxheimer reactions. That's just a part of the plan. And I like that you warn your clients about that because, it's not always sunshine and rainbows.
No, and I would say one more thing as well is as you go through this healing journey, as you become more in tune with your body, you become more aware of things that you might not have been aware of beforehand. So it might feel like things are getting worse or you're noticing new symptoms, but a lot of times it's you just being in tune with your body a little bit more than you were before, which is another big factor.
Yeah, that's a huge one. And I feel like a lot of people just lack that self-awareness and that connection with their body, like with food sensitivities. I don't know if you guys do, and that's okay if you do, but I don't run food sensitivity tests anymore because I think it's ever changing. You guys can chime in and see if, you guys agree or disagree with that. But I think if we just had our clients do pulse tests, like maybe a food that they suspect that they are sensitive to, okay, well, let's just do a pulse test to see if your body is reacting in that moment. You know what I mean? Instead of having to run like this massive, expensive test when, really it's just like whatever your body is reacting to in that moment, because things can change. Because I did a food sensitivity test 5 years ago, and the results that I did more recently when I was in FDN school were completely different. And it's just because that at that time I was living a different lifestyle. I had a different environment, different toxic relationship. And so my immune cells were kind of like tagging certain things based on what I was experiencing emotionally at the time.
Right.
So I don't know what your guys' opinion is on food sensitivity tests, but I'd love to hear it.
So I guess we do run food allergy tests on our patients, and we test for both IgG reactions and IgE reactions. I'd say the most common test they might come to us with the food allergy test, but it's like a hair analysis, and those aren't super accurate. So we like to do a blood analysis, and it's pretty sensitive and specific. The test that we use is through Immunolabs, and essentially what I want people to understand when I run these tests, it's not about the foods themselves, it's about the immune system, and we test for, why I run this test is to see what extent of leaky gut do you have going on, because that's where food allergies and sensitivities come from, is leaky gut. So essentially I'm like, if you want these food allergies to go away, or you don't want to be sensitive to specific foods, we need to heal your gut. We need to work on healing the gut, and by avoiding these foods, you're essentially progressing that process faster, because you're not ingesting these foods that are harming you, essentially.
And I would say on top of that, it's a lot of patients come to us and they're asking for a food allergy or food sensitivity test, but they don't have the fundamentals set in their diet in the first place. They're eating a lot of ultra-processed foods. They're eating a lot of gluten. They're going out to eat. They aren't even getting the bare minimum for water intake on a daily basis. I'm like, that is going to be more monumental than testing specific food allergies. And until we can get that under control and you can tackle that piece, then there's no point, in my opinion.
Yeah, exactly. It depends on who you're trying to treat. You know what I mean? And their lifestyle, the choices that they're making. It can be a valuable test. I'm not trying to say that it's bullshit, the food sensitivity test, but like I just find myself using them less and less, because I notice that when I do my detoxification process in a particular way, the food sensitivities end up, becoming non-existent by the end of it. You know what I mean? So it's like, it really depends if the person in front of me has a ton of reactions to food. Like maybe they've gotten to a point where they're like, all I can eat is meat. You know what I mean? So it would provide some valuable insights there and just kind of like see where you're at and how you're reacting. But yeah, like it really just depends on who you're treating. Like I said, you choose the tests based on what they're giving you, the symptoms that they're sharing with you, like what their health history looks like. And that's kind of something different that myself and you two do, is that we're actually asking those questions. And that's not what you're going to get when you go to a conventional doctor. They're going to run the most basic surface level lab test that doesn't give you any functional insights at all. And then they're not going to give you any suggestions into what you should be doing within your lifestyle and your diet to make a change. They don't even really believe that. They are, you have a set of symptoms, let's categorize you, diagnose you, and then you have take a pill. Which one do you prefer? That's their answer.
You hit it right on the head. The conversations and the appointment lengths are so important as well. I mean, the average American doctor's appointment is 6 minutes long, right? Like, I'm sure you're sitting down with your clients and patients and actually having conversations, doing a deep dive on their health history. The forms that they fill out are probably 3 times as long as what it is going to the doctor. And those are important pieces on top of the comprehensive testing that we do that play a huge role in the patient's health.
Oh, absolutely. I ask 300 questions right off the bat. The first thing that I do, covering every single possible thing. Are you exposed to mold now? Were you exposed to mold in the past? And asking it in a specific way so that I can create a timeline and pinpoint when I think the symptom started and what caused it. And then I create like a pre-lab treatment plan where it's like, okay, here's all the things that you could do right now, today, before we even get any result back, so that you can start seeing a shift right away in your energy, in your chronic pain, in your skin. And then once we get those lab results back, we'll fine tune. But you find so many healing opportunities when you just simply ask the questions, and listen to them, because they're not being listened to. They're being dismissed. They're labeling everything as anxiety. They're pushing them SSRIs, especially females. It's horrific, the stories I hear from my clients.
It's sad.
Females and the elderly, for sure.
Yep, it's big.
I could go down a rabbit hole about people, or about the health of the elderly population and how doctors treat them.
Oh my goodness. And I think a lot of the health of the elderly people has to do with like dental infections, oral care.
Yeah.
I had 2 patients this week that I had them go to their doctor or go to their dentist because their labs were showing it. CRP
Oh,
was
like
elevated.
dysbiosis?
Yeah.
Crazy dysbiosis in people that have even just like root canals, metal fillings. I get a lot of people with the mercury fillings, neurological disorders, OCD, anxiety, panic disorders. It's like every time you're chewing your food or eating something hot, that's off-gassing. And your brain's right there. Mercury is one of the most toxic things you could put in your body. And it's embedded in your tooth.
Yeah, and it really affects the thyroid as well. Yeah.
Oh, big time. Oh,
Yeah.
yeah. Absolutely. Hormones. Yeah, absolutely. But yeah. So my next question is, what are like the 3 top root causes that you found in your clients that are behind all of the symptoms that they are struggling with?
I'd say, well, we always like to say that there's never just one thing for one person, right? It's a combination of all of the life events that you've experienced over your lifetime, obviously. But I would say when we run the testing, the one of the most common things I see as an issue is either gut dysbiosis, like the microbiome is imbalanced in some way, shape, or form, usually stemming from an issue with their digestion, from the root, like they're not connecting with their food. Or blood sugar and insulin resistance is another one. Like the top 2, I would say.
Yep. It's pretty common.
I'll add the third one, I guess. The third one I would say is a disconnect with whether that mind, body, spirit. They don't have an outlet to connect with themselves. They aren't sitting with themselves. They don't have an outlet when they're stressed, whether that's prayer, whether that's meditation, that's breath work. Journaling, a lot of us don't have that outlet, and a lot of people try to do all of those things and not one of those, and that plays a huge role in it, right? The mind plays a huge role in it. Past trauma, all that stuff plays a big role in it too.
That's where we learn all of our our patterns, our coping mechanisms. There's I think a big problem within psychiatry is like the misdiagnosing of individuals that have endured trauma as children, especially as infants. I was in a relationship with somebody that had that was told that they had bipolar, but come to find out it was actually borderline personality disorder. And that actually comes from the misattunement with their mother in childhood. So like if you have a parent who's narcissistic, self-centered, or maybe they're not even like that and they have like postpartum depression, that can cause a child to have maladaptive coping mechanisms that reflect way later in their adult life, you know? So whenever they feel stressed, they immediately go to their external world in order to soothe themselves. So they rely on their partner in order to soothe themselves instead of like going internally and figuring out how to like calm themselves, because at some point in their infancy, they were crying out for help and it was met with anger or something that didn't align with what they actually needed. So there's a lot of that going on, especially now that there's so many women that are getting recommended these postnatal supplements or whatever that have synthetic forms of folate in them that are literally causing postpartum depression because they have MTHFR and they're not able to methylate that.
Yeah.
So it's a problem. It is causing a mental illness in our society. Not to get too off topic, but I mean, I think it reflects a lot into our physical health when we are coping in those maladaptive ways.
It's amazing seeing patients go through and obviously clean up their diet and their lifestyle and do comprehensive testing and get in the gym and start moving their body. But the patients that come to us and they say, you know what, I scheduled an appointment with the therapist, I'm going through XYZ protocol, they found God, they did something on that spiritual, emotional level, the way that their body heals after that point is just, it's unbelievable.
It's like almost immediate.
Yeah, just adding that
Yeah.
component in, or especially after you lost it, is so cool to see.
Yeah, I constantly hear that too, is like the turning point in a lot of people's health was that they found God or some kind of faith or like belief in something greater than themselves and developing what their purpose is. Because I feel like a lot of people just kind of go through life surviving and just trying to get to the next day. And they're carrying all that weight and that baggage from their past too, and they've never quite looked at that. Or maybe they even, you know, had an experience in childhood where they didn't get beaten or their dad wasn't an alcoholic, but then you have those like micro things that shape our belief in the world. And it ends up, you know, maybe we create limiting beliefs about ourselves, or maybe we kind of are hypercritical of ourselves. That triggers our nervous system to stay in a sympathetic state when we're constantly criticizing and beating ourselves down. So shifting that internal voice from a demanding, condescending, disciplinary voice, tapping into your higher self and allowing that loving, supportive, nurturing voice to come in so that you feel more guided instead of, you know, like demanded into action, because we don't really act on that, right? We end up feeling scared and we don't really get much out of that. When you're led with fear and not love, expect problems, expect to have poor health, because that is the lowest vibration that you can be in, is fear.
Absolutely.
Yeah.
Yeah, you get paralyzed.
Yeah, absolutely. Okay, so I did want to talk about skin for a moment, because I was watching one of your videos that you were talking about, Collin, and like how skin issues like eczema, psoriasis, acne are actually a reflection of our gut microbiome and dysbiosis in the gut. So if you could touch on that a little bit and give us a little more insights into things like H. pylori and imbalances in the gut, I'd love to hear what you have to say.
Yeah, and I feel like starting with the fundamentals, that when you have something going on with your skin, it's usually something going on internally. It's not like a direct reflection of what's going on externally, right? It's not like a burn. And most people will think hormones, but hormones are also secondary issues to something else. So it requires you to dig a little bit deeper, and that typically is in the gut microbiome for a couple reasons. One, the bacteria that live there, but also because of the immune system itself. When you look at eczema, you look at psoriasis, those are immune system driven diseases. So if you have imbalances with the gut microbiome, your short chain fatty acids, your butyrates, they're not where they need to be. That messaging back up to the brain throughout the entire body is not going to be there, and it's going to present itself on the skin. It's like your skin is like your billboard. Mm-hmm. And it's hard to ignore. Commonly, something that I talk a lot about my patients with is dandruff and yeast. right? So that's something that's not necessarily always on the skin, but dandruff itself, or obviously that white coating on the tongue, the thrush that you see, commonly associated with yeast itself, which is something that you should be looking for on comprehensive stool testing. Obviously, craving sugars, there's a bunch of symptoms that are associated with that. You can probably have a good idea whether you have yeast overgrowth or not. But that's something that we like to look at on stool testing as far as mycology goes. You want to talk about bacteria?
So I will say, like with H. pylori, most commonly is going to contribute to things like eczema. I've even seen it contribute a lot to cystic acne. It's like one of the most common triggers for cystic acne. And like Dr. Collin was saying, most people think cystic acne is hormonal. Most of the time it's bacterial in nature because they prescribe you something like Accutane, which is that high dose vitamin A, which essentially is what kind of starves out those bacteria. But obviously it helps in the short term, but then long term, it's just those bacteria can continue to grow because the imbalance itself was not addressed in the first place. And I think what's important to understand is that these imbalances in the bacteria in your microbiome, they're not just there by accident. You know, they are caused by something else as well. And usually it's an issue with your stomach acid being too low. You're not sterilizing your food appropriately. You're not digesting your food appropriately for these bacteria to feed off of. You're not getting enough fermented foods. You're eating ultra processed foods, you're causing yourself to have leaky gut. There's all of these driving components to this imbalance. So yes, you can, take probiotics, you can take antimicrobials, but if you're not getting to the foundational pieces of your gut health, these imbalances will continue to happen.
Absolutely. And you have to also think about it like this, like, if you want a healthy gut, think of it as like you're making a soup, right? We throw in all of these delicious components. We put in high quality, the best flavor of like beef broth, whatever, the vegetables, the meats, and then you have this beautiful soup. But what if you start throwing in literal battery acid into your gut? The pot is probably going to start to degrade. You know what I mean? And your soup's going to taste like shit. So like, you can't be eating inorganic food that's got pesticides lathered all over it. That's the biggest contributor to leaky gut, at least I found in my practice. And just stress overall, like we were talking about at the very beginning of the show, is that when you have that constant nagging anxiety, you're in sympathetic dominance, your stomach acid will lower and you will not be breaking down your food appropriately. When I had my cystic acne issue, it totally made sense because I wasn't focusing on organic food. I was only focusing on high protein, didn't care about the quality. Quality totally matters, like it was pounding whey protein and my acne was just so insane, like all over my neck and just like boils. And I like really like chubby cheeks. And, they used to say that like, oh, you just have like a baby face. No, I was inflamed. Like I was so inflamed. And when I did my testing in FDN school, like my GI map was so jacked. I had extreme Sig-A levels. And those are basically like the defenders in our gut lining, right? And then my zonulin was extreme. So I had way leaky gut, like basically open borders. Anybody can come through, just causing systemic inflammation. It was just very eye-opening. And like I needed that data to be glaring me right in the face and saying, hey, your lifestyle choices actually aren't that healthy. You know what I mean? I came from a bodybuilding background and I thought I was healthy because I'm eating, balanced meals, high protein, I'm working out, but I was overdoing everything. And I was, there were some sneaky things getting in that I wasn't paying attention to, and I wasn't managing my stress. So your lifestyle matters. Again, friendly reminder, like you can't outwork a diet that is contaminated or that is nutrient deficient, essentially.
Yeah, it's impossible.
Yeah. It's a tricky thing to get around. But speaking of GI maps and your considering your past experience with your Crohn's disease, I want to talk about the manipulations or the suppression within the health space and like what do you see in the health space? Like what information do you think is the most suppressed? Like when your client comes to you, they're like, oh, I didn't know about that. Or like, they're like kind of like befuddled about your kind of like your game plan. You know what I mean?
I would say it comes down to testing. Most of the markers or tests that we run, individuals had no idea even existed or they had access to. I mean, we talk about this all the time with metabolic dysfunction and blood sugar. They think the only marker that really matters is their glucose and their A1C. They've never even heard of fasting insulin before. That's just one example of hundreds. So I would say testing. They feel like they are restricted to testing that is covered by insurance and is going to basically say yes or no to them needing a medication or not.
What have you seen, Lena?
As far as suppression, how much your diet, your lifestyle, your sleep can impact your healing. No, it's not necessarily suppressed, it's just not talked about openly and enough. I feel like I see so many ads for medications to, help you with XYZ symptom. I'm sure we've seen them all on TV, or if you use YouTube TV, it's like every other ad is for a medication. No one says, hey, why don't you go outside for a second? Why don't you go sit in the sun for a second? Why don't you, try this recipe that's all whole foods? Why don't you, hey, take a break from television and actually go read a book or go literally touch grass or, get some sleep? Nobody actively promotes that stuff in the media. I think it's fully suppressed. I think that I'm not going to discredit all doctors because there are some that are good that do promote this type of stuff, but a lot of them, they don't have the tough conversations with their patients about this sort of thing. I think that they're short on time, so they have to do what they can with what they have, and they give a medication, and then a patient thinks that they're stuck on that for the rest of their life because they don't know that they can implement things to get better and to get off their medication.
Absolutely. I feel like what's being suppressed is the connection to ourself and the suppression of like the value of anecdotal evidence and personal experiences. I think we're seeing this even more so now with the whole scenario with autism and vaccines, or just even like any type of childhood disorder and vaccines. It's like, why are we not listening to these mothers that spend so much time with their infant child? How are you discrediting their story? Why would you say that that person is a liar? And like saying that like, oh, my child was totally normal, and then all of a sudden my doctor decided to do a checkup or a catch-up appointment and injected them with 6 vaccines at once, and now he's nonverbal. Sorry, but that is something that we should never be ignoring. It's disgusting, and it really irritates me, and it's why I wanted to ask you guys, okay, well, what do you see that you feel like is being suppressed in the media? And I think it's just the suppression of actual people's experiences, and we're just not considering people and their own self-awareness, and we're just, we only need to look at the science. This can only be true if there's been a study produced on it, and it's just
and not
we
just
know
a
what's
study.
motivating that.
Yeah,
Go
not
ahead.
just a study, like a meta-analysis that's perfectly orchestrated and funded by who knows who.
Yeah. I will say our child is not vaccinated. We chose not to do any sort of, vaccination, and we definitely got some looks from people when we made that decision, but everyone who meets our child says he's the happiest baby they've ever seen. He's the healthiest baby they've ever seen. He had no problems gaining weight. He was exclusively breastfed for the first 10 months of his life, which was daunting, but I knew it was necessary for him, so I chose to do that. And yeah, he's happy, he's healthy, he's developing in a way that's advanced, and I stand by that decision. We've done our research, we've read the inserts, and like you said, anecdotal evidence is evidence. And like Dr. Collin said, some of these studies are funded by the very people who are profiting off of you being sick. And that, and we always talk about the scientific method. Science is always meant to be changing. You're always going to have hypotheses. You're always going to have theories. But these vaccines are not laws. There's not laws that are associated with this sort of thing. And you can't tell me that injecting something that stimulates the immune system is not going to affect the immune system. Or the neurological system. It's asinine sometimes when people talk about this stuff.
It's really crazy, and just because not 100% of people become, debilitated by these vaccines doesn't mean that it's not affecting populations within our society, and like I did a lot of research on VAERS and I was trying to understand, I'm like, okay, what's the connection here? And I was looking at percentage of the population that has MTHFR, and it's ever growing now, that gene mutation that basically makes you not incapable, but very inefficient at methylating and detoxifying certain compounds. And there's a lot of adjuvants and preservatives in these vaccines in order to make it stable. So you inject a child with MTHFR with a compound called polysorbate 80. That is going to go directly to the brain, because you know what that compound is capable of doing? Opening the tight junctions within the blood-brain barrier. And then all the other bullshit and contaminants that are in there go straight to the brain. And that's why we're seeing kids with SIDS, dying almost instantly, getting autism, all of these neurological disorders, and so on. It's just like, why are we ignoring that? Like, we already understand that there are people in this world that have these genetic mutations, and then they're incapable of processing out these adjuvants in their body. Like, why aren't we considering those people? Why aren't we testing them? Why aren't we genetically testing them before we're administering vaccines? Like, we're doing this and we're giving them all these vaccines because we think they're sensitive and that we need to protect them, when really we're harming them extremely. So, yeah, I digress, but that's just my my little soapbox. It irritates me so much because I've been talking about this for over 6 years. I've been posting about this, and I get people that unfollow me, that try to come at me, and tear me down. And it's just like, I'm simply asking a question. I never said that vaccines cause 100% of cases of autism. No, I'm saying that it can cause some cases of it. And I think that we don't need to inject our babies with 84 vaccines before they're 10 years old.
Yeah.
100%. And we should have that information presented to us as consumers, as parents, and be able to make that decision. We live in the United States of America, so that should be presented to the parents, and the parents should be able to make that decision without getting beat up by their doctors, by their family, by whoever, their doctors especially.
As far as suppression goes, informed consent is suppressed.
Yes, bingo. Oh my goodness. And like, why don't these doctors know what's on the inserts and the ingredients? Like, that is just so befuddling to me. And it's like, they get all of their information from these vaccine manufacturers, and they're kind of like, incentivized to ensure that their entire practice is vaccinated. And that's why they get so, hostile with parents when they choose not to vaccinate, is because they're damaging their percentage of fully vaccinated. That's why they're being pressured, is because they get paid a lot more, or at least most of them are. I wouldn't say all doctors are, but there's a lot of practices out there that do get paid a commission based on how much, I think it's 70% or more of their practice is fully vaccinated. It should be illegal.
Yeah,
there should be zero incentive.
I've had patients where they were fired as patients from their primary cares for not vaccinating their children. And what was cool for us is we got to see a seminar by Dr. Paul Thomas, who made his own study comparing his practice of vaccinated children versus non-vaccinated children, and they immediately pulled his license.
He's currently suing the CDC.
Yeah.
Oh yeah, like I pray for him and good luck with that, because it's like a mafia, and they will tear down anybody that comes out and speaks truth. I mean, there was a guy that got arrested for suggesting that people with cancer eat apricot seeds. Have you heard about that?
Yeah.
Yeah, and it's just like, there's a compound inside of apricot seeds that actually are anti-cancer. It's just like, he's not trying to scam anybody, and like, how much money could you really be making off of apricot seeds?
Right.
You know what I mean? Like, it's just crazy. It's like, we're at war with these people. But I really appreciate you guys getting on the call today. I'm sorry to cut this short, but I got a client right after this. But the last question I want to ask you guys is, what would your favorite book or podcast be that you have found to be like extremely valuable for either you or your clients?
Yeah, so I'll actually name a podcast. His name's Michael. He's actually all over the TikTok space. His account goes by Higher Up Wellness, and he has the Higher Up podcast. The reason I like his content, now he doesn't agree with everything that we do as far as organic and seed oils. He's more like an 80-20 lifestyle guy, but he's great at motivation and making you see through a lot of the bullshit. So it's very inspiring. A lot of my patients like that as more of like a pick-me-up and kind of an escape to a podcast where you can actually focus on healing. So the Higher Up podcast is absolutely great.
Amazing. And you, Lena?
I'm not a podcast listener usually. I read a lot of books. My favorite book, as far as like for women, I would say Getting in Tune with Your Cycle, Getting in Tune with Your Hormones. The first book that I ever read was called In the Flow by Alyssa Vitti. That one was great, and as far as breaking down what each cycle means, what happens, how to optimize your hormones during each phase of the cycle. There are a couple things that I disagree with her as far as like philosophy in different parts of the cycle, but that's a whole nother story. But she does a great job of breaking it down and getting you started as far as if you're coming off of birth control or you're wanting to learn more about your cycle, you're wanting to learn how to optimize your fertility, your hormones. That is a really great starting point.
Awesome. Those are both great resources. I haven't heard of either of those, so I'll give them a look. But thank you guys for joining me. That's it for today's show. I want all of you listening to remember that a diagnosis does not have to be your identity and that there is hope for you. If this episode resonated with you, please share it with someone who needs to be reminded that healing is possible. Until next time, keep choosing curiosity over fear and keep believing in your body's ability to thrive. Catch you guys next time.